Hello, anatomy colleagues. This is our last video regarding the skeletal system basics. So we're going to finish it off with a discussion of what is the axial and appendicular skeleton, and then we'll focus on some terms that are specific to features of the bones. So we'll be using these terms throughout the rest of our discussions, so we're going to get a head start on this right now. We have two learning objectives and many definitions to work through, so make sure you can answer these in your own words at the end of this video. Okay, so the skeleton is subdivided into the axial and the appendicular skeletons. The axial skeleton forms the central supporting axis of the body. So that's going to be associated with the longitudinal axis of the body, where we have an imaginary line that runs through the body's center of gravity. So those bones that are very closely associated with that are going to be included with the axial skeleton. So those would include the skull, the vertebral column, and bones of the thoracic cage. So that would include the sternum and the ribs of the thoracic cage. And so they're going to be highlighted in kind of the more bone-like color, the off-white color on this illustration on the right. The appendicular skeleton includes the bones associated with the appendages. So that would include the bones of the upper limb and those connecting pectoral girdle bones. So that's including the clavicle as well as the scapula, as well as the lower limbs and the connecting pectoral girdles, including the hip bones as well. And as you might imagine, there are more appendicular bones than axial. So you're going to have 126 appendicular bones if you're not counting the potentially variable sesamoid bones other than the patelli and the pisiforms. The axial skeleton only has 80 bones, and much of the bone count really is going to be in the wrist and the hands, as well as the ankle region and the foot. The bone counts go up considerably there. Now we're going to be using a lot of terms to describe features of the individual bones, and these structural features are adapted for specific purposes. Many of these features are not present at birth, but they will develop in response to certain forces, and they'll be more prominent in association with the adult skeleton. So say in response to tension at the bone surface from tendons and ligaments, that's going to cause new osseous tissue to be deposited, and that will create larger raised or roughened areas on the bone, such as tuberosities, or tubercles. Additionally, if neurovasculature is located on or near a bone, it can create depressions or openings. So we typically divide these features into one of two main categories. You're going to have those depressions and openings, so allowing for a passage of soft tissue or the formation of joints. And then we will also have processes, lots and lots of processes that are simply put just projections of bone. So these will form joints too, but they can also be attachment points for connective tissue, such as tendons and ligaments. Let's define a few terms associated with depressions and openings. And this isn't exhaustive, but some of the major ones. A fissure is going to be a narrow slit between neighboring bones or part of a bone that allows for neurovasculature to pass through. So this image here on the right is showing the superior orbital fissure, which allows many of the nerves associated with the orbital region to pass through. A foramen is simply put a hole. There are lots of foramina in the skeleton, and some can be quite small, like the supraorbital foramen in this illustration on the right. But some can be comparatively large, like the foramen magnum that allows the transition between the medulla oblongata and the spinal cord. A fossa is a shallow depression in the bone, kind of a little divot. A sulcus is a furrow in the bone, so it typically accommodates neurovasculature, but it can also sometimes hold a tendon. And a meatus is a tube-like opening, and we will have one on the side of our skull called the external acoustic meatus, which will lead from the external ear into the middle ear region. Moving to processes, we will start with processes that form joints. Condyles are the most common of these. You have condyles on the humerus as well as the femur and the tibia. These are typically large and rounded, although there are some examples that are more convex, such as the condyles of the tibia, and these are found on the ends of bones. A facet is a smooth, importantly flat articular surface. The most clinically relevant facet joints are between neighboring vertebrae. And a head is a rounded articular projection that is in close association with a neck region just distal. And a neck is just going to be kind of a, a more constricted portion of the bone. Heads are usually associated with ball and socket joints. So you'll have one on both the femur as well as the humerus. Those are both the heads that I highlighted there, but there are other examples of heads on other bones. Now let's discuss processes that form attachment points, and there are lots of these and lots of different words for very similar structures. Tendons and ligaments often attach to these processes. A crest is an elongated projection or prominent ridge. The iliac crests at the top or the superior portion of the hip bones are excellent examples of these. An epicondyle is a projection located just proximal to a condyle. They're very often associated with ligaments. So we'll have lateral and medial epicondyles of the femur that are just proximal to the condyles of the femur. Now, a line on a bone is a long, narrow ridge that's generally less prominent than a crest. We have something called the linea aspera, which kind of is a line on the back or the posterior portion of the femur. And then a spinous process is a sharp, slender projection. If you are able to palpate the midline of your own back, you can palpate the spinous processes of your vertebral column. But wait, there's even more. I told you there were a lot. The next three are basically describing the same thing with differing sizes. So a trochanter is a very large projection, and they are solely located on the femur. So the greater trochanter of the femur is a rather large projection on the lateral side of the femur where many, many muscles attach. A tubercle is smaller, usually rounded projection. Tubercles are much more numerous throughout the skeleton. So you can see, say, the lesser tubercle of the humerus or the greater tubercle as well. And then a tuberosity is it's usually larger than a tubercle. And one thing that's unique about a tuberosity is that it will typically appear much more roughened on the bone, not as smooth as what you have with tubercles. So you can see the deltoid tuberosity on the humerus in this image on the right. Excellent. We have reached the practice question. So let me know what you think about this one. The ribs are a part of which division of the skeleton? Is it the appendicular or is it the axial? And hopefully you have landed on B, axial being the correct answer. The ribs are a part of the thoracic cage, which is part of the axial skeleton. But say I asked about the tibia of the leg. Hopefully you're going to say that's part of the appendicular skeleton. Or if I asked about the frontal bone of the skull, that's axial because it's part of the skull. So as we continue our discussion and talk about all the different bones of the skeleton, think to yourself, is this part of the axial or the appendicular skeleton? All right, excellent. Please make sure you can answer those learning objectives on your own. And I thank you for your time and attention.